Hi, my name is Sharon Britton, and I will be doing a head, ears, eye, nose, and throat assessment on you today. I'm going to start off by washing my hands first. I can see already that you have some symmetrical facial landmarks like your nasolabial folds and your palpebral fissures. I'm going to examine your scalp. Have you noticed any abnormalities or changes recently? No? Perfect. I'm going to palpate your temporal arteries. And now I'm going to go down to your temporomandibular joint. Can you open and close your mouth for me? Okay, perfect. One more time. Great. Now I need you to clench your teeth for me. Great. Now give me a big smile. Puff your cheeks. Great. Now close your eyes really tight for me. Open them wide. And now wrinkle your forehead for me. Perfect. Now we're going to move on to the eyes. First, I'm going to assess your extraocular eye movements. So without moving your head, please follow my finger, okay? Great. Now we're going to move on to your visual fields. So with your right hand, cover your right eye. And while you're still looking at me, tell me how many eyes you can see that I'm holding up, okay?
How many eyes?
How many fingers you can see? No, look at me. Okay. How many fingers do you see?
2.
Okay.
1.
Okay.
2.
Perfect.
1.
Now we're going to do the same thing, but with the left hand. So left hand, cover your left eye. Now tell me how many fingers I'm holding up.
2.
Perfect.
1.
Perfect.
2.
Look at me. Okay.
1.
Great. Okay, so now I'm going to dim the lights a little bit. This is to shine some light in your eyes so I can get a better visual of your pupils. It might be a little bit bright, but it'll help me to inspect better, okay? Okay, perfect. So I'm going to grab on my pen light. Take a look at your eyes. I can see that your pupils are both equal, round, and reactive to light and accommodation. Okay, now I'm going to grab my ophthalmoscope. I'm going to fix the lens with my index finger and adjust the light. And I'm going to be standing 3 to 5 centimeters in front of you so that I can get a better visual. Is that okay? Perfect. Okay, let's see. So, can you open up your eye? Thank you. Now I can see that your retina is pinkish in color. Your veins are pulsating and they are larger than your arterioles. And your arterioles appear bright red. Your optic disc is sharp and well defined, and your macula is located temporal to the disc. Okay, so now if you can tilt your head back a little bit for me, I'm going to be inspecting your nose with my otoscope. Okay, I can see that your septum is midline and your turbinates are lateral to the wall. There's no swelling or edema present, and no lesions either. So now I'm going to be moving on to your mouth. Okay, I'm going to put on some gloves first. I'm going to inspect your lips. Perfect. Your gum and your teeth. Great. So with my tongue blade, if you can open your mouth, stick out your tongue, say ah.
Ah.
Perfect. I can see your uvula is midline. Your oral mucosa is moist, pink, and intact. No lesions or exudate present. I can see that you have a Mallampati score of 1 because you have your pillars. I can see your pillars, your uvula, your soft palate, and your hard palate. Now with your tongue, can you stick out your tongue for me again? Can you lift it up? Perfect. Now with your tongue, there you go. Push on the side of your cheeks, on the left and on the right. Great. Okay, perfect. So now we're gonna move on to the neck. So I'm gonna inspect your thyroid region. Now if you can swallow for me. Perfect. Can you swallow for me one more time? Okay, great. Now I'm gonna assess your preauricular lymph nodes. Now your postauricular lymph nodes. Your occipital lymph nodes. Your tonsillar lymph nodes, submaxillary, now your submental. Now I'm going to do your anterior cervical and your posterior cervical. And last, we're gonna do your supraclavicular lymph nodes. Perfect. I'm gonna wash my hands. And that is the end of our assessment. Thank you.
Thank you.